Every 12 seconds, someone new contracts HIV.
And every 16 seconds, somebody with HIV or AIDS dies.
I think that with statistics like these, HIV information would be spread far and wide across the world.
But in reality, 35% of people think that you can get HIV from kissing, and 28% think that there's a vaccine already.
Considering neither of those are true, something's wrong here. The lack of information about HIV is causing divisions between family and friends.
First of all, many of you may be wondering, what is HIV and AIDS?
HIV/AIDS stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immune Deficiency Syndrome. HIV is a deadly disease that destroys the body's immune system by attacking the blood cells that help our bodies fight diseases. With a severely damaged immune system, HIV makes those who have it more susceptible to other illnesses. Over time, HIV will cause AIDS. Those with HIV may not have AIDS, but everyone who has AIDS has HIV.
There is no cure for HIV/AIDS, but there is a treatment available that can lengthen the lifespan of those who have it.
Not only does HIV affect our bodies, but it also affects our brains. When HIV/AIDS infects the brain, it causes a condition called AIDS Dementia Complex, or ADC. ADC may result in slurred speech, confusion, muscle weakness, and sudden changes in mood and behavior.
With so many people getting such a dangerous and incurable disease, it's important to know how it's transmitted. The three most common ways are
having unprotected sex of any kind with someone who has HIV/AIDS,
direct contact with blood or other bodily fluids except saliva with someone who has HIV/AIDS. The most common way for this to happen? Through sharing needles for shooting drugs.
And the third is from mother to child, either in utero, during childbirth, or through breastfeeding.
It's also important to note some of the history of HIV/AIDS. When HIV first became widespread in the 1980s, it was known as a gay man's disease. This is because gay men are the most heavily affected of any demographic. However, anyone male, female, gay, straight, can get HIV or AIDS. HIV originated in West Africa in a species of chimps, not gay men.
For some good news, HIV/AIDS is easy to prevent. Here are the three main tips.
Number 1, safe sex. Abstinence is the best way for guaranteeing your partner won't give you HIV. But if you decide to have sex, make sure you use condoms and limit your number of sexual partners.
Number 2, don't inject drugs. This will greatly reduce your chance of contracting HIV.
Number 3, get tested. Knowing your status is very important. If you have HIV, you can get treatment and prevent yourself from spreading it to others. And if you don't have it, you can make decisions to ensure that you won't get it. Make sure you and your partner get tested.
Getting tested may sound scary, but knowing how it works can make it much less so.
HIV tests are done either by drawing blood from the vein, a urine sample, or an oral fluid sample. The tests check for HIV by looking for the antibodies that fight the disease. If you don't have any antibodies, you don't have HIV.
Most tests take a few weeks to get the results back, but there are rapid tests available which will give you your status in just 20 minutes.
If you go to get tested for HIV, your partner should too. While you may not have it, your partner could. And for your own safety, it's important to know whether they do or not.
If you want to get tested, you can go to the Teen Health Clinic in Madison High School. There, everything is free and confidential.
4 of you, can you get HIV from kissing, holding hands, or from a toilet seat?
No.
Can you tell from looking at someone that they have HIV?
No.
Is there a cure for HIV/AIDS?
No.
Knowing about HIV is important for your personal as well as your loved one's health and safety. Always remember that while this deadly disease is out there,
preventing HIV is as easy as 1, 2, 3.